Hi, welcome to Ask a Dentist, a show where we answer questions submitted by users online. I'm your host, Alex, and today we have a special guest. Let's give a warm welcome to a dentist from Taiwan, Jing. Hi, Jing. Thanks for joining us.
Thanks for having me. It's my pleasure to be here with such a wonderful host.
Nah, you flatter me too much. How are you?
I'm doing great. And you?
I'm also doing great. Thanks for asking. Now then, let's get this show started, shall we? Now, do you have a newborn baby, or will you be expecting your baby soon? Are you wondering which is a better option between breastfeeding and formulated milk? We hope that this video will help you a lot. So, here we have our first question. Which is better, breastfeeding or formula milk?
I would definitely say breastfeeding. It's one of the most effective ways to ensure child's health and survival. WHO suggested that children should initiate breastfeeding within the first hour of birth and be exclusively breastfed for the first 6 months of life, meaning no other food or liquids are provided, including water. From the age of 6 months, children should begin eating safe and adequate complementary food while continuing to breastfeed for up to 2 years and beyond. However, only 1/3 of infants are exclusively breastfed for the
Wow.
recommended 6 months.
So, could you elaborate a little more? Exactly why is breast milk better than formula milk?
While breast milk is the best source of nutrients for infants, it is tailored to the baby's specific nutritional needs. It contains immunological agents such as immunoglobulin A and immunoglobulin G and has anti-inflammatory properties that offer protection to the potentially immature immune system of both terms and preterm infants. Also, breast milk contains bioactive components that are resistant to digestive processes and that enhance the infant's immune system, thereby contributing to short and long-term health protection. Studies have shown that breast milk can reduce health risks for breastfed children and protect them against short-term infection, such as acute otitis media, gastroenteritis, diarrhea, severe lower respiratory infections, asthma, sudden infant death syndrome, obesity, and other childhood diseases and conditions.
Well, that's all great for the baby. But hey, some others are asking, how does breastfeeding our babies also benefit us? Does it also provide us any, health benefits?
Yes, breastfeeding also confers health advantages to mothers. Mothers who breastfeed typically are at lower risk of developing certain diseases such as breast cancer and ovarian cancer. In general, longer duration of breastfeeding are associated with improved health outcomes. Breastfeeding reduces postpartum bleeding and hemorrhage risk, helping mothers recover from childbirth.
Thank you, Jin, for your answers. Now, as we move on to the next question, does breastfeeding have any influence on the child's oral development? With all the sucking action going on, does it affect our child's oral development? Does it shape what their mouths will become in the future?
Yes, nutritive sucking, such as breastfeeding, can affect craniofacial growth and development.
Wow.
However, whether breastfeeding or bottle feeding will lead to altered occlusion is still unclear. Different authors stand for different results. Some said yes, some said no. Articles that stand for a potential association claim that a bottle-fed infant has more potential to development of a malocclusion than breastfed child, and breastfed child is less likely to develop the dysfunctional muscular patterns. Breastfed babies were more conducive to the favorable development of occlusion than those who were bottle fed. Studies show that the mean duration of breast milk feeding as milk source is higher in those with no posterior crossbite than those with posterior crossbite. Another study revealed that the prevalence of posterior crossbite was lowest in children who were breastfed for at least 9 months. On the contrary, some articles stands that there is no association existing A retrospective study pointed out that no association between the way of feeding and altered occlusion is found. What exists is the association between non nutritive sucking and altered occlusion. Another study found no difference in prevalence in both groups. So, to conclude, the association of malocclusion to whether breastfeeding or not is not clearly defined. Specific malocclusion traits are plausibly associated with sucking movements rather than using general malocclusion in disease.
That's wonderful to hear. Now, on to the next question. Well, some parents are saying, hey, would breastfeeding lead my child to, well, caries or cavities at such an early age? I'm guessing what they're trying to ask is breastfeeding related to early childhood caries?
The answer is a big no.
I agree
There
with
is no
that.
evidence showing relationship between early childhood caries and breastfeeding. In addition, the available evidence indicates that breastfeeding up to 12 months of age is associated with a decreased risk of dental caries. There is no cariogenic factor included in human milk. Cavity is more related to complementary feeding with cariogenic food or drink or inadequate oral hygiene practices.
Well, to expand a little more onto that question, exactly how do we maintain our baby's oral hygiene? What should we do to clean our baby's mouth? How should we clean our baby's mouth?
Well, from birth to 6 months of age, you should always clean and massage the baby's gums after feeding with moistened gauze. And from 6 to 12 months, you should just continue to clean your baby's gum after feeding. And once a tooth comes in, you should start using child's soft bristle toothbrush.
Thank you, Jin, for all of the fantastic answers. And that will be all of the questions. Would you like to give the audience any additional suggestions?
Well, first of all, you should know that dental decay is an infectious and transmissible disease, so you should avoid testing the temperature of the bottle with your mouth, or sharing utensils, or cleaning a pacifier or a bottle nipple by putting it in your mouth. And you should take care of your own mouth to reduce the amount of bacteria that you're transmitting to your child. And you should schedule your baby's first dental appointment before his or her first birthday or within 6 months after the first tooth comes in.
Well, then, that will be all for today. Again, thanks for joining us.
And again, thanks for having me.
Bye. Catch us again next week for a new episode. Again, I'm your host, Alex, and this is Ask a Dentist.